Hi, Camille here reporting back to you from Section 1, Term 2. I'm an Adult Health 1 with Professor Lukowski. I am, in this segment, I'm going to go ahead and demonstrate my actual piggyback of hanging my medication in this procedure. So at this point, I would have gone ahead and implemented standard protocol. And I would have gone ahead and make sure that all of my physician's orders matches my MAR, that this is the correct patient, and as well as the correct medicine and dose to be administered, and for any other procedures that may have been implemented. All right, so at this point, I have my actual doctor's orders here, which is for Zocin, and the order is for 1.5 grams, which after doing my calculations, it comes out to 0.5 milliliters. So after doing the further calculations, it will come out to 14 drops per minute. All right, so at this point, I'm going to go ahead and sanitize my hands, which will be maintaining the asepsis technique, as well as I'm going to actually put on my clean gloves. All right, and so at this point, I have already prepared my medication, which was the 0.5 milliliters of the Zocin. And so I would have already done my actual cleaning with my alcohol swabs of my medication top before preparing it. And so I have done that, so my medication is ready. And so now I also have my actual medication label. And I have my, I would have put up there the date and time, the initials, the dose, and the amount that is to be administered on there. So at this point, I'm going to go ahead and inject my medication. All right, and this will go in a sharps container. All right, so now I'm going, after injecting my medication into there, I'm going to, all right, so at this point, I'm gathering my tubing for my piggyback out of its sterile field, and I'm going to attach it. And I already have went ahead and labeled it with the date, the time, the actual type of tubing, and the dose as well. So now that I have it attached, I'm going to go ahead and prime it to make sure that the tube is actually working. And it was already pre-clamped, so I'm going to unclamp it. I just want to make sure that I'm actually going to do my squeeze first. All right, so now it is working. So I'll put the clamp back on. All right. So now I'm going to go ahead and hang it. And then I'm going to lower my actual primary. All right, now I am actually hanging my primary lower than the actual piggyback, so that now I can attach, and I'm going to go ahead and sanitize the end before I attach it with my alcohol swab. And the clamp is still on for everything, so now I'm going to make sure that this clamp is off, which it is, and this clamp is as well. And before I go ahead any further, I'm going to make sure that the arm doesn't have any infiltration on it, and it doesn't. It's clear. All right, and everything is clamped. So now I'm going to go ahead and establish the flow rate, which is at 14 drops per minute. I'm going to check. All right, and it is flowing at 14 drops per minute. All right, so now I'm just going to go ahead, because this patient, this is his first time actually receiving this medication. I'm going to go ahead and just monitor that patient to make sure that he is receiving the medication properly. And I'm going to do so for 15 minutes and just, make sure that everything is still good. So, and then at that point, once I come back, I'm going to make sure that once the medicine has ran its course, I'm going to go ahead and assess the site. The site is looking good. I'm going to assess the actual response of the patient to make sure that there is no signs or symptoms of anything that may develop possibly. And then now I'm going to go ahead, once I've reestablished that, then I'm going to make sure that I dispose of any sharps into the sharps container. Do that, and then as well as with my labeling of my tube, I have put on here my actual date, the time, the medication dose, the tubing size, and then at the same time I'm going to reestablish the actual flow rate, which was at 14 drops per minute. Alright, so and then at this point, and when I've done that, then I'm going to go ahead and use my gator clamp to ensure that as well. And so from here, I can go ahead and document what I just did, which is to make sure that I put the date, the time, any instructions that I may have given the patient, the actual flow rate, the medication type, the dose, anything that may go further with that, and as well as state the actual IV site that will go with that. All right, so that should complete everything. All right.